NEA Baptist Hospital just received a limited supply of the monoclonal antibodies used to treat positive coronavirus patients. The hospital gave its first dose this morning, being the first ever given in Northeast Arkansas.
He said, "I just want you to know you're the first person in Northeast Arkansas to get this treatment." I won't tell you I'm nervous about it, but I've been nervous ever since I tested positive.
Harmon isn't too sure how she got the virus. She started to develop symptoms Wednesday and was diagnosed last night before the hospital received their shipment of the antibodies. After researching the virus, she wanted to try any treatment fast.
Whatever you do, the first few days are critical. I've always been told if I got this, my chances weren't good. So you're willing to try anything.
The process takes about 2 hours. It's administered through an hour-long IV, and medical staff monitor Harmon for an hour after. Chief Medical Doctor for NEA Baptist, Steve Woodruff, explains how the treatment works in the body.
Pretty much cover up the coronavirus, which has a spike protein on it, and make it so it cannot regenerate itself when it hits in the body. So you have to give it early.
The treatment received emergency approval from the FDA to treat high-risk patients who qualify, like Harmon, who has heart disease, diabetes, and lung issues. Woodruff says the drug works immediately, something Harmon says she feels.
Really, I feel fine. I'm not aching like I did Wednesday night.
Woodruff says this could help hospitals who are overwhelmed in treating COVID patients.
If we can head this off, and we can treat some of these high-risk patients early, then we can prevent them from being admitted and going down the path and save lives.
Now Harmon was able to go home after the treatment, and doctors will continue to monitor her over the next few days. But Woodruff says he feels optimistic. For Northeast Arkansas News, I am Sarah Doan in Jonesboro.